Dr. Faisal Shuaib talks about state of primary healthcare facilities and plans by the government to address the challenges in the sector. Dr. Faisal Shuaib, welcome to the program.
Thank you for having me.
Let's begin with your view on the state of primary healthcare in Nigeria today.
I think I share exactly the same views like millions of Nigerians that we're not where we need to be when it comes to the delivery of primary healthcare. When this government came in 2015, Mr. President raised an alarm and said he was not satisfied with the state of primary healthcare. And he made it very clear that irrespective of where people live in Nigeria, they should have the same quality of primary health care. That is not where, that is where what we're trying to achieve. The Honorable Minister of Health then went ahead and said, in terms of strategy, let's have at least one functional primary health care facility in each of the almost 10,000 wards in Nigeria. So the state of primary health care in Nigeria did not start in 2015 in terms of the deplorable state of some of the primary health care centers. It's something that's been there for several decades. The rot has been there. But with this administration, government made it very clear that it was not acceptable that Nigerians continue to die from preventable diseases in our communities. And that is why we've stepped it up and say enough of the rhetoric, enough of so many years of saying primary health care is not where it needs to be, we're not getting good quality health care. Now let's do something about it.
Okay, so moving away from the rhetorics, like you said, the president did rightly take that step in the beginning of the year, in January to be precise, and he talked about revitalizing primary health care centers, more specifically getting 10,000 functional. What is the state of that promise?
This is like a 2-year plan. First, we've started with, hey, let's make sure that in every senatorial district, at least there's one primary healthcare center that has the right complement when it comes to infrastructure, when it comes to the human resources, when it comes to the drugs, when it comes to all the commodities that are required. After that, we've now moved on to not just one senatorial district. We're now looking at one local government in each local government. At least let's have one functional primary healthcare center. Now, after that, they will now begin to narrow it closer to having one functional primary healthcare center in each ward. So with the one primary healthcare center in each senatorial district, that brought it to 110. So 109 plus one in Niger State that was focused on due to the outbreak of Lassa fever.
So are you saying that at the end of this year, how many would you have, would you say is now functional?
At the end of 2017, 95 primary healthcare centers will be functional in terms of having the right types of renovated infrastructure, the right types of human resources, and the commodities, medicines that are required.
Okay, let's take a look at some data that we have. We understand that about 91 contracts, were actually awarded between 2014, 2015 and of course, you might correct this. Some of the projects, cost about 22 million to erect PHCs. But when we go to states like Niger or Benue, and even the FCT, we see uncompleted projects here and there. What exactly is going on?
Again, this is part of the challenge that we face, right? Too many uncompleted primary healthcare centers littered across the landscape in Nigeria. So what government is doing, what we're doing at the National Primary Healthcare Development Agency, is to actually look at what the data is showing us. We've collected all the information since 2001 of all the uncompleted primary healthcare centers.
How many?
So right now we're looking at close to 1,000 of them all across Nigeria, based on the information that we have, which at different stages of completion. We now need to put a pause on trying to construct new primary healthcare centers where we've not fixed these uncompleted ones, right? And then why are they uncompleted? Is it because the funds lapsed at the end of the financial year? Or is it actually because the contractors took the money and never completed the job, right? And in which case, they have to be held accountable, right? So we're going to go to the National Assembly and say, what are we going to do about this, right? We have to fix this. So enough of year in, year out, funds being allocated for primary healthcare centers when we have so many of them that actually need a little bit more for them to be completed.
What are you doing about manpower, which is still a critical challenge?
We are collaborating with the Nigeria Governors Forum. We're saying that we have to do an audit of the manpower in the states. So in some states, the issue is that you don't have enough manpower. In other states, it's a maldistribution of this manpower. Let us get a correct sense of how many people you have, the number of health workers you have in the state. In some places, you have a preponderance of nurses and midwives in the urban areas. Meanwhile, in the rural areas, you don't have enough. Maybe the problem is around redeploying them. When you see that you have a gap, then you can now talk about recruiting additional ones. You can also talk about even the health workers that are within the system now and are not doing the work that are very critical. Can you do task shifting? Can you train some of these non-essential health workers to do work that is very critical to the survival of the vulnerable groups, pregnant women and children? So we're doing this all together with the National Association of the Medical and Health Workers Union, the Community Health Workers Unit. We're also doing this with the Council of Nigerian Nurses and Midwives to understand what the gaps are in each state and then how we can close that gap. It's going to cost a lot of money, and that is why we're also working primarily with the Nigeria Governors Forum.
But speaking of which, the Governors Forum actually announced at one of the NEC meetings they actually pushed for the 1% of Consolidated Revenue Fund to be implemented. But we know that even since this Health Act was passed sometime 2014, we haven't seen implementation of this particular, request. What's happening?
Right. So the 2017 budget was an opportunity for it to be passed. I know there were a lot of deep discussions, but from what I hear, there's been further discussions between the executive and the legislative branches of government, and it is very likely that we'll see a setting aside of this 1% of the Consolidated Revenue Fund for the Basic Healthcare Provision Fund. So we're really optimistic. I think it's getting very clear that that is the way to go. We need to invest a whole lot more in our primary healthcare services, in our insurance health system, and I think reason has prevailed, and there's a huge likelihood that the funds will be made available in the 2018 budget.
Let's take an update now of the yellow fever vaccination in Kwara, Kogi, and even some other parts of the country.
The National Primary Healthcare Development Agency is providing leadership when it comes to providing preventive campaigns and also outbreak responses. We've had cases of yellow fever in these states that you've mentioned, and the National Primary Healthcare Development Agency, working with the Nigeria Centers for Disease Control, it mounted a robust outbreak response, which includes trying to control the outbreak so that it doesn't spread, and also providing the vaccines to the population who are at risk. We have done the outbreak response. What we're now planning to do is a preventive campaign across all those states where any case of yellow fever has been reported. And we feel pretty confident that with the vaccines being available, we'll be able to protect Nigerians from further spread of yellow fever.
All right, we'll have to leave it at that. Thank you very much, Dr. Faisal Shuaib, for coming on the program.
Thank you very much. My pleasure.
Thank you very much. Well, thank you for your mails and tweets, as always. I will take a few of them right away. I have this one coming from our Twitter handle, Diamond Emperor, and it says, the NDLEA should note that the new haven for drugs in Abuja is now at the Banex area. Weed smelling and being carried all about. They should do something about it. The police can also help. Well, thank you, Emperor. That's as much as we can take right now. Keep sending in your views and comments using the email address and Twitter handle on your screen. Also, be sure to share anything happening within your locality. And don't you forget, you can view the program on youtube.com/channelsweb/videos. Thank you for watching. I'm Gloria Umezuki. See you again.